Greetings. My name is Shimwe Ngeze from the Center of Reforms, Innovation, Health Policies, and Implementation Research. Together with my colleagues, we prepared this policy brief on evidence-based strategies to improve access to primary health care in rural Tanzania. Tanzania has made progress in expanding primary health care through the Primary Health Services Development Program. The program strengthened facilities, built theaters, and recruited health workers. Yet, preventative and promotive services remain weak, and rural communities still face barriers such as long travel distance, limited services, and high out-of-pocket costs. To address these challenges, our center embarked on a rapid review to identify evidence-based strategies that can improve access to healthcare in rural settings. Persistent challenges, such as inadequate funding, political constraints, and shifting priorities, have left many rural communities without equitable access to healthcare. This context highlights the need for practical, evidence-informed strategies that ensure quality care reaches underserved populations. Our analysis used a framework adapted from Peters and colleagues, as you can see on screen, which defines access to healthcare across 4 dimensions. Number 1, geographic accessibility, which refers to distance or travel time to reach services. Number 2, availability, which refers to whether the right type of care is offered. Number 3, financial accessibility, whether care is affordable without hardship. Number 4, acceptability, how well services align with social and cultural norms. These 4 dimensions guided our review and identification of strategies. We conducted a rapid review of existing research from Google Scholar, Hinari, and PubMed, alongside other gray literature sources. Our focus was on interventions relevant for rural, resource-limited settings. The strategies were then organized into the 4 dimensions mentioned previous. The results from our rapid review under availability led to several emerging themes. The first theme that involved was task shifting, followed by the use of digital devices, also the use of incentives, and last but not least, the use of medical relief strips. These are just short-term missions that fill workforce gaps that also training local staff for long-term capacity. Those were the themes that emerged under availability. Now, let us look at the second dimension, which is accessibility. The first theme that emerged was the use of mobile health clinics. Secondly, the use of walk-in centers. Third, outreach services. And lastly, the use of telepharmacy, which basically is remote access to medicines that reduce disparities and financial burdens. Let us look at the third dimension, which is acceptability. Studies reveal that healthcare is more effective when it is acceptable to communities. This means respecting cultural norms, engaging communities in the design, and ensuring respectfully, culturally competent care. Let us look at the last and final dimension, which is affordability. Evidence revealed that strategies to improve affordability include expanding community health insurance, subsidizing essential services, and reducing indirect costs like transportation. All these reduce the risk of families facing financial hardships when seeking care. In conclusion, improving access to primary health care requires multi-sectoral as well as evidence-based approaches. Equitable care can be achieved through strategies like task shifting, digital tools, rural workforce incentives, mobile clinics, outreach services, telepharmacy, and measures that improve acceptability and affordability. When evidence informs policy and communities are placed at the center, quality primary care can be reached for every Tanzanian, regardless of where they live. CeRIHI would like to thank the President's Office, Regional Administration and Local Government, our partners Uganda and Ethiopia for their support. We are especially grateful to the East Africa Regional Evidence Support Initiative under the LEAPS project funded by IDRC, the Hellwit Foundation, R4D, and Robert Bosch Foundation. Their commitment to strengthen evidence use in policymaking has been vital in shaping this work. Thank you so much for your attention and have a lovely day.